Osteoarthritis of the knee affects approximately 10 million Americans. Men are more likely to suffer from OA prior to the age of 55, while women are more commonly affected by OA after age 55. Today we're going to talk about some available options for relieving pain and symptoms with expert Dr. Susan Zito. She's a rheumatologist from Suncoast Internal Medicine, and we also have with us senior Olympic basketball player Earl Whitty. Welcome to both of you.
Thank you.
Now, we're specifically focusing on osteoarthritis of the knee. So, doctor, can you give me an idea of exactly what that is?
Osteoarthritis of the knee is basically a degenerative process that occurs in the joint. It is the cartilage that lines the ends of the bones that wears away, and the loss of the protective natural joint fluid inside that thins and doesn't perform its function of lubrication.
Okay, so how do you know you have it? Earl, what kind of symptoms did you have?
I think it was around 05, I started experiencing a lot of pain in my knee. I couldn't jump, I couldn't run, I couldn't even walk with my wife. I thought my basketball days were over. I was looking for some options.
So, Dr. Zito, this was obviously life-changing for Earl. What other kinds of causes are there other than strenuous athletic activity?
Absolutely. Wear and tear is a big one, as are any prior injuries or current injuries. But also, as you mentioned, gender in and of itself could be a risk factor. Excess weight, obviously, and genetics, believe it or not.
Now, what can we do about it? Are there non-surgical treatments?
Obviously, non-steroidals and cortisone injections are a common treatment modality. But hyaluronic acid is also an option for patients. Hyaluronic acid is a natural substance found in healthy joint tissue that naturally lubricates, cushions, and protects the joints. And the arthritis comes when it's lost. Nowadays, we can actually inject this into the knee specifically with a non-avian hyaluronic acid product called Euflexa.
So it's very manageable if you catch it early on.
The earlier you catch arthritis, the more cartilage cells that can be regenerated and protected by this hyaluronic acid therapy. It can help patients maintain their active lifestyle and stay healthy in other ways. Euflexa is a series of 3 injections a week apart that are introduced into the knee joint in your doctor's office. And patients get relief for months, and I have some even for years.
So, Earl, you look like you're in fabulous shape. What did Euflexa do for you?
Well, I was back playing after a short time, and when I got the shots, they were painless, a little pinching of the knee, that's all. I get the shots every 6 months, and I played in some senior tournaments that we won, some silvers, we won some bronze medals. But I hope to be playing for a long time. I've seen young people in the stands who talk to me and say what an inspiration we are. I just turned 75, and I hope to be playing a long time.
And insurance? Does your insurance cover this?
Insurance covers it, yeah.
Okay, that's terrific. And where do we go for more information on Euflexa?
I would suggest euflexa.com, where you will see that Euflexa is the sponsor of the Senior Olympics, and you can read about other athletes that they have helped keep active.
Dr. Zito, Earl, we look forward to watching you play basketball for many more years to come. Thank you very much to both of you.
Thank you.